I am standing in front of you with bare hands. The thyroid anatomy, physiology, pathology, lab test, therapeutics already explained here in detail by the eminent speakers. I have nothing to give more than that. In therapeutics, as we know, every doctor has his own ideas, and here is my only chance. I like to share my experiences. First of all, I like to remind you that my practice method is very ordinary one. Surely, I am not a classical prescriber, but I like to give single remedy when right situation apt to me occur. I stress apt to me. Those who are new to my class, I plead them not expect a professional type of speech, but a natural talk from a private practitioner. I am not a teacher nor a regular faculty. Here I am compelled to speak in English, in which I am not much comfortable, actually, because some doctors from other states are here, and I have to respect them. When entering into the topics, in case of hypothyroidism, in my practice, I mainly depend upon mental symptoms, mental state, disposition, physical general, sometimes aggregation of common symptoms. As hypo affect mental sphere and his or her moods, energy levels, in most cases, symptoms are very clear, and with a single remedy itself, most cases respond well. Usually, we homeopaths get very good response in hypothyroidism. I here like to speak about some remedies which give me good result and its prescription points that I am depending. Hypothyroidism may be diagnosed accidentally when routine blood checkup or treating for some other complaints like menstrual disorders, PCOD, obesity, hair falling, depression. Doctor asks them to test routine blood checkup and hypo is diagnosed. The main symptoms we know it is fatigue, weight gain, mood swings, and lethargy. I think my sound is clear. Okay.
Yes, sir. Audible. Yes.
Oh, yes. Hypothyroidism, we know it is underactive thyroid. Thyroid is in hypofunction state. So everything is slowing down. Heart rate, brain activity, memory, bowel movements, etc. all are slowing down. So thereby fatigue, constipation, mood changes, etc. occur. Symptoms of hypothyroidism, it is fatigue, depression, mood changes, changes in menstrual cycle, constipation, unexplained weight gain, or difficulty in losing weight, dry hair, hair loss, puffy face, elevated cholesterol level, dry skin, greater sensitivity to cold, slow heart rate, swelling of the thyroid gland, sometimes carpal tunnel syndrome. In most of the symptoms, we have got many remedies. And in baby cases, cold hands and feet, constipation, extreme sleepiness, hoarse cry, little or no growth, loss of muscle tone, floppy infant, persistent jaundice, poor feeding habits, puffy face, stomach bloating, and swollen tongue. Causes autoimmune disease, we know Hashimoto's like, or thyroid nodules, thyroiditis, over medication, abnormal iodine levels, etc. Other causes, radiation therapy to neck area. In certain cancers, such as lymphoma, require radiation to the neck. So thyroid gland may be damaged, resulting in disease, thyroid disease. Radioactive iodine treatment may cause hypothyroidism or hyperthyroidism. Use of certain medication to treat psychiatric problem. In last case, Dr. Ashik told about lithium, the use of lithium and causing hypo, something like that. Certain medication to treat heart problems, psychiatric condition, cancer. Medicine like interferon, interleukin extra also causes thyroid complaints. Thyroid surgery cause hypothyroidism. Too little iodine in diet also cause hypothyroidism. Pregnancy, due to inflammation, there is a temporary chance. And there will be postpartum thyroiditis sometimes. About food, yesterday Dr. Sergi talked in detail. I am skipping. I am about the thyroid anatomy, physiology, etc. I am going in a very speed manner because it is already well explained here by experts. I am eager to rush into the therapeutics. My plan of treatment. In most hypothyroidism, we get very good results in a short time. I had lot of failures in earlier times. Now failure rate is some low and success rate is more. Initially, I used a routine prescription. Now I am depending mainly the symptoms, either mental, physical, towards a group of remedies. For better prescription, detailed knowledge of actual material medica is a must. The main remedies I am using, first of all, I am like to tell the name. Then I like to give some description, the prescription points. Okay. The main remedies, first remedy is Natromure, Oramet, Thyroidinum, Tuja, Calcarecarb, Silesia, Calicarb, Graphitis, Lactasis, Lycopodium. Second grade of medicine, Natrongarb, Natropos, Magnesium ore, Ammonium ore, Ammonium carb, Beretta carb, Orum iodide, iodine, carbonium sulfur, mercurius, argent nitricum, calcareous iodide, conium, bromium. Mucus viscolasis, Lufer operculata, Spongia, bromium, Badiaga, conium, mercoid flav, mercoid roof, Crotalus cascavellata. Then Julian remedies, I will tell you later. Usually I am giving intercurrently Morgan Pure, Dicentrico and Psychotico, bowel nosodes. Anti-miasmatic drug also using, and the frequent use of hypophysin lobe anterior, because hypophysin lobe anterior is controlling thyroid. Let us go to each drug. Before going to drug, I am depending upon some particular symptoms. Mind-wise, if the patient is reserved or not, introverted or not, then we can, in case of Natromure, from appearance, it's that type. Calcarecarb is that type. Tendency to haste. Some people are very haste in talking, walking, eating. In that case, we can give haste remedies. Natromure, Madorna, Mercurius, etc. Some patients are timid. Now I'm going much faster. Some patients are going timid. Pulsatilla, Silesia, Natromure, etc. Some are mild, some are yielding. Pulsatilla, Lycopodium, etc. Some patients are dictatorial. Some are commanding. Then we will think of Aurum, Lycopodium, Thyroidinum. Some are loquacious. We will give loquacity remedy. Lactasis, Caliodide, Natrongarb, iodine, etc. Some are indifferent. We will give indifferent remedy. Some are easily startled. We will give that typeness, perspiration, chill in the face. Local symptom, I depend in patients. Sometimes there will be warts or mole or skin tag or family, hairy face, etc. Let us go to drug wise, each drug and how to prescribe each drug. First, I like to give the explanation of Natromure. Okay. Natromure is I got numerous Natromure cases with very success. If Natromure is the case, surely we will get the result within 10 or 20 days. TSH will fall suddenly in high potency. Natromure patient, we know, prefer to be alone, hide. They don't share anything to you because she doesn't like consolation or advice. She hates advice. Nostalgia is there. She is joyless. Joyless means even in cheerful company or social gathering, she is very sad. The speech nature is laconic speech. Laconic speech, indifferent speech. She wants to escape from the speech. And a persisting hatredness is there. The face is calm, but hatredness is there. Just like an ash under its fire. If a perfect condition occur, a wind blown, the fire blown. Just like that, if sudden anger occur due to certain situation, easily provoked, mood swing is there, difficult comprehension is there, tendency to make mistakes are there, and natriuretic has got large goiter, and the patient is emaciated. Usually, hypothyroidism patients are obese. Here it is emaciated. Another drug with TSH increase and emaciated is silicea. Here you can see hair falling is there, a melancholic patient, a reserved patient. There is a heightedness there. Patient is indifferent, and there will be constipation. There will be dryness of hair, the lips cracked, and drowsiness and emaciated. That is natriuretic. There are some other more in our bacteria medica very related to natriuretic. If the patient is natriuretic and we are not getting enough result, we can think of that remedy. We are giving natriuretic in every potency but didn't get result. Then we are giving this ammonium ore and magnesium ore. Ammonium ore and magnesium ore. Okay. Natriuretic we are using for certain clinical conditions. That is for juniors, I am saying. After the tongue, number one remedy. Tongue after. Another tongue ulcer. Another remedy is lycopodium. Another is anthracene. And we all know the keynote symptom: headache, migraine, constipation, dry skin, and it is a remedy for tinea alba, light white pale patch on face of babies. You see, tinea alba. Natriuretic 30 is infrequent doses will clear it. What's on palms? Emaciation, diabetes, cold. For cold, especially cold discharge from one nose. That is Phytolacca or natriuretic. And it is a remedy for vitiligo. Main remedy for vitiligo. The related remedy I already said is ammonium ore. Ammonium ore, we know it is an obese remedy. It is got the same natriuretic mentality, antipathy to certain people. It has got drowsiness. It is indolent, body fat, leg things, and large buttocks. Ammonium ore is an important remedy for sneezing in the morning. Ammonium ore, ammonium force, and ammonium carb. Sneezing in the morning, important remedy. Ammonium ore has got dandruff, sciatica, etc. So it is related to natriuretic. Both are more. That is the relation. Another remedy is magnesium ore. Magnesium ore also, like natriuretic, it's a negative remedy. It prefers solitude, lachrymose humor, indolence, stupefaction, lips cracked, sleepiness is there. Constipation is very important. In corona cases, many doctors had success in treating anosmia with the magnesium ore, with the boric symptom. Singam ore also you can think of that. Smell perverted, fecal odor, and taste perverted in singam ore. Another remedy I use is Morgan Gardner in anosmia. So I already told about natriuretic, ammonium ore, magnesium ore. Natriuretic also benign natriuretic symptom. Both had sun aggravation, we know. It is hypochondriacal. Disgust for life is there. And they were timid patient. Like natriuretic, violent fit of passion is there. Sadness is there. And a large goiter is there. Hard swelling on thyroid gland. The textbook says hard swelling on thyroid gland. In clinical practice, we use natriuretic in chopped fingertip. The fingertip, nice fingertip. That is an important remedy for natriuretic and natriuretic. In natriuretic, both are aggravation from heat. Natriuretic is a remedy for sunstroke like Beretta-carb and Glonine. Okay. And it is a very important remedy for sterility. Natriuretic and natriuretic. Natriuretic is another remedy for goiter and same condition. Both remedies for sterility. Sterility is indication is post-coital spasm. That is, after coition, all the discharge come out with the uterine spasm. That is natriuretic. Next remedy is Oromet. Oromet is one of the most important remedy. Many cases are benefited by Oramet single dose itself. Formerly, my idea with Oramet is totally negative patient. But long ago, in 2000, I think, 22 years back, I had a conversation with Dr. Deepak of Cochin. I don't know whether he is present here or not. He gave some new light into the mental state of Orm. He told me Orm is gold. So Orm thinks he is the best, like Platna. Platna thinks she is superior, others are low. So Orm failed state is the depressed state. Orm normal stage is he loves life and he thinks he is the best and he is confident. After that, I used to give Orm for patients of dictatorial, the rubric dictatorial. You cannot see the in repertory. If the patient, our patient is dictatorial or commanding nature, I like to give Orm. Most probably single dose will affect high dose. Other symptom of Orm, we know, love for life is lost. There is self-hatredness and want to suicide. If no love for life, no continuing of life. Everywhere darkness. You can see in Simsifuga, as if a dark cloud settled over her. In format like that, more than that. She see obstacles everywhere. Irresistible impulse to weep, and a quarrelsome, and ailments from disappointed love. So, format main rubric I am giving is dictatorial. Surely it is a melancholic and sad remedy also. In clinical practice, we are using it for this one, cryptorchidism. Cryptorchidism, very important remedy. Hydrocele also for menopause also, amenorrhea also. Next important remedy is thyroidinum. Thyroidinum we are using for 3x in many cases, but hypertension also giving very good result. The main nature of thyroidinum, like Oramet, I like the rubric, take the rubric commanding or dictatorial, then quarreling, then stupor is there. Quarreling tendency is marked because it is a violent nature, thyroidinum, excited at every situation. Goiter is there, exophthalmic goiter, etc. And suspicion of persecution is there, like lachesis. In nutshell, it will cause some dictatorial, great violence and depression. That is thyroidinum. In that case, you can give in high potency, highest potency. Next remedy is calcareous iodide, which I am using 3x, 10m, etc. Calcareous iodide, both calcarea and iodine is in it, and it has got indifference and thyroid enlargement at puberty. We are using it for tumors of breast, uterine fibroid, adenoids, etc. No other symptoms are seen in calcareous iodide. The intercurrent bowel nosodes I am giving is Dysendrico, Morgan Pure, Psychotico, etc. 3 remedies. Next remedy is Silesia. Silesia is emaciated like Natamure and indifferent and very yielding patient. Emaciated, but we can get TSH high, cacatic, sleepy, yielding. Starts from least noise. Affects thyroid on right lobe. Right lobe, we had some remedies. That is Orm-iodide, mercoiod flav, and Silesia. In case of right lobe enlargement, mercoiod flav high potency will do wonders sometimes. Orm-iodide also, Silesia also. This is a right side remedies. In left side, mercoiod robe is the remedy. Silesia also had, it is mild yielding. Sometimes it disposition to fly to rage, like Natamure. And obstinacy is there, obstinacy. In for juniors, it is a remedy for asthma, to cure asthma, for children's asthma. In asthma occurring every month, we will ask the patient, if it is occur in the new moon, we will give Silesia. If the child is obstinate and the asthma occurring in every new moon, we can give Silesia hypertension and it will cure him. Okay. Other remedies, Calicarb. Calicarb also, somewhat obese patient, Patient is very drowsy, yawning is there, goiter large size is there, and Kalikarp main symptom is distension of abdomen. Distension of abdomen. Even after passing fat test, the abdomen will be distended. Single dose of Kalikarp 30 will cure that condition. Other important remedy is Tuja. Tuja is very important remedy. In that case, Tuja, patient, is like Ormore and Natramore. It is sad. Patient, very quarrelsome. Very quarrelsome remedy. You can think iodum, aurum, thyroidinum, spongia, Tuja. Quarrelsome. Easily angered and hastily talk like Natramore, Lillian Dick. Patient talk hastily and swallow words. Mental depression after childbirth. That is postpartum thyroiditis sometimes. Mental depression after childbirth, you can see it. Very depressed, dropsically bloated face. The Tuja patient face is dropsically bloated. You can see in Natramure, cortisone, ACTH, EPS. I repeat, Natramure you can see. You can see in cortisone, Julian remedy. You can see in ACTH. Okay, juniors, I think you got it. Tuja grave salt, cold drink. That is, in a nutshell, mental dullness is there, stupefaction is there, warts are there, white scaly dandruff are there. So the importance of Tuja dandruff is it extends to the face, like meserium, extends to the face. In Silesia, you can see pimples at the forehead. In Tuja, you can see dandruff at the forehead and the face. Okay. Tuja has got constipation, etc. And Tuja is for postpartum thyroid. Other remedy I am using for dictatorial patient is lycopodium. Lycopodium, mercurius, aurum, thyroidum. If a patient is dictatorial, surely you should give high potency. Lycopodium. Lycopodium is dictatorial, quarreling, commanding, fault finding, and he seeks disputes, discontent. Another nature of lycopodium is a glass of wine causes excitement. He become always mischievous. Like our mimicry artist, one Biju, Kottayam Biju, mimicry artist, famous. The drunken appearance is. Lycopodium is avarice, seem to be submissive, but actually not. Complete indifference is there. And we are giving one lycopodium in clinical practice. It is a very good for lycopodium molluscum contagiosum when occurring on the right side. Molluscum on the right side. If molluscum in every side, we are giving calcareous carb. If patient is lean and molluscum is there, we are giving Silesia. If calcareous carb is after calcareous carb not improvement is there, we will give calcareous flow. And if it is right side, we are giving molluscum. And right side thyroid enlargement also. Next remedy is calcareous carb. Calcareous carb, everyone know, is an obese patient, sweating easily, chilly, with much anxiety, alarming for little reason. Calcareous carb important symptom is patient anxiety about imaginary calamities, anxiety. If her husband late, he thinks there will be some accident. If child late, she thinks someone absconding him or her. That is anxiety about imaginary calamity. That is very important. The structure of the calcareous carb is important. That is obese. And the mind is important. That is imaginary calamity. And the disposition to alarm. And on thyroid gland, when you look, you can see hard stroma swelling on thyroid gland. And drowsiness is there. So there is obesity, there is drowsiness, there is swelling of the thyroid gland, there is disposition to alarm, and thinking about imaginary calamity and anxiety about health. He thinks every type of disease he got, always thinking about health. Very clear indication. We can give hypertension in that case. The patient is obese, usually obese. And next remedy is graphitis. Graphitis stone, you on the internet, on the Google, you search for graphitis. You can see black stone. pencil battery polishes are made from graphite. So graphite is black. Likewise, its inner self is also dark. Hopelessness, like our Simsifuga, utter darkness in the sky. In the graphite is utter darkness inside. No hope, dejection, weeping for unwanted thing. And graphite patient is a climatic lady. She is obstinate. She got skin problem, dry skin, and she like a calcare carb, fear of calamity, inclined to grieve unnecessary, and patient is very timid, obese. So we can think of graphitis in hypothyroidism, especially in climatic years, skin dry, constipation, etc. Okay. Next remedy is iodine. Iodine is very important remedy. Iodine itself and iodine combination, both are important. Iodine itself, iodine combination, there are many drugs. We have aurum iodide. Iodide is there, but no relation with the thyroid. We got aurum iodide, baryta iodide, calcarea iodide, kali iodide, mercury rope, mercury flav, plumbum iodide, stannum iodide, cincum iodide, many iodide. And about iodine itself, we know iodine a lean person with a large hard goiter. There is constrictive sensation in the throat, constrictive sensation. There are few remedies with constrictive sensation in the throat. Apart from iodine, it is one remedy, Crotalus cascavella. For juniors, you hear properly. Crotalus horridus, you know, it is Crotalus cascavella. It has got constrictive pain. If TSH is not falling and patients got a sensation of constriction in the throat, you can think of Crotalus cascavella. Another remedy is spongia. Spongia got a large goiter. Another remedy is cincum iodide. Cincum iodide you can see in Padak materia medica, goiter pressing in bodily. So I am going to iodine. Iodine has got large goiter. Patient is emaciated, Loss of flesh is there. He eat very well, but he is losing flesh. Very irritable, impulse to do violence, highly restless. He can't rest everywhere. Impulse to run, impulse to murder, and he uh, don't like working. Slightest effort causes perspiration. Goiter with the sensation of constriction, and and she is very cross, and loquacity is there. Loquacity, and usually cheerful, and he is violent, cheerful, emaciated, and eating well but emaciated. That is iodine. And the remedy is Beretta-carb, one of the important remedy, because like in hypo there is sluggishness. Beretta-carb is sluggishness in mind and in sluggishness in body. In brain development is pure. In case of old people, childish manner can see. In child, you can see elder man. Child is like play. In case of older man, woman playing with dolls, you can see. Thyroid gland is enlarged. Premature old age is there. Constipation is there. Great weakness is there. Drowsiness is there. And the patient is in lachrymose mood. That is Beretta-carb. Another medicine is aurum iodide. I already told it is a combination of aurum and iodide. Aurum is very melancholic, but iodine is got some happiness. So when it mixes with iodine, aurum iodide is very cheerful medicine, and mood change is also there. So when we giving it to the medicine applied to thyroid or fibroid or ovarian cyst, we are looking for the mental symptom of the patient. Patient is cheerful, pulsatile is like it is changeable, and in case of thyroid, it is right lobe of thyroid is enlarged like silesia, mercury flav, and changeable mood and cheerfulness is very important. That is aurum iodide. There are many iodide. I already explained it there. And another important feature of aurum iodide is loquacious with mirthness. Loquacious with happiness. You can see locacity in lacacism. That is locacity with the boreness. It is locacity with the happiness, like kali iodide. That is very important remedy for fibroid enema of breast, and thyroid, aurum iodide. Hope you all got it. Another remedy is bromium. Bromium, it is indurated. Goiter is indurated goiter, and mentally there is a feeling as if someone behind, and low spirited and indifferent. Bromium has got a special cough, that is a special sound. In our Materia Medica, some remedies got special sound, that is bromium, spongia, verbascum, and one more. This verbascum got special sound, so bromium, and spongia got, and osmium. Osmium cough into as a cough into a tube, special sound. That is for juniors, not related to the topic. Next is spongia. Spongia has special character that you know. Patient is combative, mean argumentative patient. Patient is argumentative in nature. He likes disputes. He likes to debate for everything, and debate with us, with doctors also. If some patient ask we argument with us, we can think of spongia, combative patient. And the patient is very bad also, very few remedies. Combative remedy, hydrogen, and the patient, it got this lachrymose mode, timidity is there, and great inclination to sink. Alternate mood like aurum iodide is there. Thyroid gland is swollen. Thyroid gland is pressing inward. So he feel constriction in the throat like iodum, crotalus cascavella, cincum iodide, etc. These drug got constriction in the throat. Please remember that. Iodum, crotalus cascavella, cincum iodide. Okay. The mental symptoms of spongia lead to it is a hard remedy because anxiety, fear future, as if something going to happen, wakes up night with the fear, shows the heart disease tendency. That is spongia. Don't forget that 2 points. Okay. So spongia is lacrimative, combative, argumentary, boasting, alternate mood, suffocation from swelling, and fear calamity. Okay. Then calcarea floor. Calcarea floor got goiter. It is indurated. And calcarea floor mental symptom is always anxious for money matters. And another important remedy is carbon itself. I prescribe mainly if patient got sleepiness. If I am got much relief from Oramet or Natramur and patient is very sleepy, I like to give carbonic sulfate in hypertension. Other remedy with sleepiness is Bareta carb, opium, gels, Natramur, Nexmoscata. Okay. And carbonic sulfate has got goiter. In Oramet, one thing I forgot to tell, herring, it is written in herring that herring given Oramet for some other complaint. After some time, enormous goiter disappeared. So Oramet is a remedy for enlarged goiter. Okay. Other remedies ferrum iodide. It is for exophthalmic goiter after suppressed menses. It is important symptom is sweet smelling urine. I don't know what sweet smelling urine. And emaciation is there. Another remedy is cincum iodide. I already told in comparison. In Padak, it is written as goiter pressing inwardly. You can see it in spongia, crotalus cascavella, iodum, etc. Other common remedies, fucus vesiculosis. We are using in obesity. Other obese remedy here in hypothyroidism is ammonium carb, levopromazine in Julian. It is not in shop, hypothalamus and RNA. I will come to that remedies. Fucus vesiculosis got goiter. It is an algae. Other remedies, lachesis. Lachesis, like graphitis, usually we are giving at climatic ages. And we know lachesis is very loquacious. One word lead to a story. A boring type loquacity patient, lachesis. And she is very suspicious. Fear of being poisoned. And she had jealousy, mocking jealousy. and she is like to contradict and criticize, and never well since the change of life. And it is a remedy for suppressed menses. In case in alcoholic patient, for if the patient is very suspicious, when doubting wife, I like to give lacasis frequently. Lacasis is poison which causes suspicion. Other remedies, ammonium carb. It is like ammonium more obese on the upper part and leg thin and a very dirty character. Textbook said uncleanness of body habit and unruly heedlessness. Very dirty character. RNA, you got a very dirty character. Patient is disobedient and obese. We are going, usually I am giving it in sneezing in the morning, allergic rhinitis. 3 remedies, many remedies are there. Ammonium more, ammonium carb, ammonium post. All are good remedies. Ammonium carb menses also important, cholera-like symptoms before menses. And the comprehension is difficult. She makes mistakes while speaking, writing. Uncleanliness of body habits. In textbook, it is written. I think we can compare with sulfur sometimes. Ammonium carb craves sugar. Kali carb is there because due to carb, both are carb, craves sugar. Ammonium carb got constipation. So it is a good hypomedicine. There is obesity, it is lachrymose, dirty character, and constipation, etc. and dysmenorrhea. Boilness, what I already told. Another medicine, if there is love failure, Oramet, acid force, mercurial for dictatorium patient. Now I am going very speed. Now I am going to Julian Materia Medica. Julian Materia Medica, very good medicines are there, very good provings are there, but some medicines are not available. I am telling about available medicine and not available medicine. I will list, first of all, I am telling about available medicine. It is RNA, very important medicine, RNA. RNA, sudden increase of weight. One day itself weight change, 3 or 4 kilo difference, sudden increase of weight. And body bruised feeling and fatigue, always worried and worries others, like Arjun Nitricum. Arjun Nitricum, Arjun Nitricum always telling his complaints, disease about disease to other people and pestering them. But RNA always worries people. Without reason, they just worries people. Patient has bruised feeling and fatigue, dizziness is there, constipation is there, swelling of lower limb is there. And Julian says that it is a remedy for hypothyroidea, dysthyroidea, psychomotor sluggishness, and dirty character. Another remedy for dirty character, ammonium carb I already told. Another remedy for dirty character is thyrostimulin. I'll come to that. Thyrostimulin. RNA, I hope you got it. RNA. Another remedy is sulfanyl amide. It has got fatigue, general lassitude, indolent, apathy, and confused. That is sulfanyl amide. Another remedy is lopa operculata. Here you can see thyroid gland very enlarged and an indifferent patient, want of reaction. Canine hunger like iodine, canine hunger with emaciation. Abundant loss of hairs. In clinical practice, we are using it for nasal polyps. So, lopa operculata, you can see thyroid enlargement, canine hunger with emaciation. A lean patient with enlarged thyroid gland with abundant loss of hair. That is lopa operculata. Another remedy is penicillin. Penicillin in Julian Britain, the syndrome of dysthyroidea, hypothyroidea, myxedema. Everything seems sad. Everything like Simcifuga, Oramet, Neutramor, everything seems sad. Penicillin is a fungus, so it is the best remedy for epidermomycosis. Fungal infection is a very good remedy. It is a chilly patient and always subfebrile temperature. Thyroid with a cardiac complication. So please remember penicillin in hypothyroid cases, myxedema cases, and the patient is very sad, very sad. Another remedy is hypothalamus. Hypothalamus, hypothalamus control pituitary and thyroid. Hypothalamus. Hypothalamus important feature is gynoid obesity. Obesity of female type obesity. like ammonium or buttock is enlarged. This is gynoid obesity. Step-on constipation. Almost all hyper remedies got constipation. There are remedies, ammonium or magnesium or natrium or graphites. Many remedies got constipation. Abundant menses, irregular menses. That too you can see in hypo. Brittle nail. Baldness in women in frontal area. That is important. Baldness in frontal area in women, in case of women. And it is mood changes like natamur and pulsatilla. Weeps or nothing like graphitis. That is hypothalamus. Hypothalamus got gynoid obesity, stubborn constipation, menstrual irregularities, brittle nail, baldness in women in frontal area, and weeps for nothing. Other remedy is Revolvia. Revolvia, it is for Graves' disease mainly. Hyperthyroidism. Hypermobility is there. Like iodine is always mobile. That is, Revolvia is always on mobility. Character instability is there, like RNA. Character is not clear. And alternate excitement and depression. Alternate ability to work, augmentation of work, then fatigue. Once he work hard, then he go to sleep and never work. Two type of character. Avoid all of it. Expression less look. And heat of whole body, because it is a remedy for hypertension. Sometimes it is due to congestion. Heat of whole body. And heat from the head is asterias rubens, congestion of the head. It is a remedy for BP, asterias. Likewise, if heat is in the body, you think Revolvia. For Revolvia, the main character is always on the move like iodine, character instability, mood swings very severe. Either he is working hard or no work at all. And heat on body. That is Revolvia. And the remedy is selenium. Selenium, total band of enthusiasm. Because thyroid is not working, indifference. And hyper symptoms also are there. Abundant sweat, falling of hair from brows, pubic area, and scalp. From everywhere, hair is falling. Sweat, greasy sweat, oily face. And it is a remedy for Graves' disease. Another remedy is thyrostimulin or thyrotropic hormone. It is not available. Thyrostimulin or thyrotropic hormone. Once more, I am telling thyrostimulin or thyrotropic hormone. It is a purified extract of anterior pituitary. In anterior pituitary, there are 7 hormones. One hormone is thyroid stimulating hormone. So this is a purified extract of anterior pituitary containing thyroid stimulating hormone. That is thyrostimulin. It is using for hyperthyroidism and Graves' disease. The eyes are protruding, and it is a remedy for hypercholesteremia. And children with unstable character, very bad at the school. Other remedies are RNA. Children with unstable character and very bad at the school. Okay. Next remedy is thallium. Thallium, we know, usually we are giving for hair falling and alopecia. In the proving time of thallium, the patient's whole hair removed within 1 week, and it came after 2 months later. Such a hair falling is in thallium. Thallium got hyperthyroidism, trembling, and emaciation, and great anxiety. Thallium is we are giving for hair falling and alopecia. Another remedy is hypophasin LA. I already told it controls the thyroid. Thyroid stimulin also contains same. Another remedy is Simsifuga. Simsifuga, we know the famous mental symptom, as if a black cloud settled all over her and enveloped her head, so that all is darkness and confusion. You can see congestion in the thyroid. You can see emaciation. You can see everything about the Simsifuga is sad. She is obese woman with a blue circle around eyes like China. Obese woman with a blue circle around eyes. And manic depressive psychosis. Purpural psychosis like Tuja. Purpural psychosis. Postpartum thyroiditis. Tuja and Simsifuga. Do you think? congestion of thyroid gland I already told, and positive hemorrhage. That is Simplifica or Actia racemosa. Another remedy is ACTH, available medicine. It is for hypothyroidism remedy. Patient is very lonely, sad, depressive, timid, undertakes everything and completes nothing. Undertakes everything. Initially he is very good and then doing nothing. That is ACTH. Hesitating speech, sluttering speech, abandoned feeling, total negative feeling, full moon face like cortisone, tuja, epis, and changing mood. That is ACTH. ACTH we are using excessive hair growth and vitiligo like that. Aquamarine, sea water, aquamarine. It is for hyperthyroidism, tremor, emaciation, sweat increase, etc. Another remedy is Arenia ixolaba, not with my hand, that remedy. It is a remedy for hyperthyroidism. It is a remedy for Hashimoto. It is a remedy for toxic adenoma of thyroid. Arenia ixoba. It is a remedy for Graves' disease. Magnesium for giving for simple goiter. Magnesium salt also a depressed remedy, more towards hyperthyroidism, taking everything in wrong side like a calcarea carb. And palm set you can see. Another remedy is cortisone. Cortisone, available medicine. We know it is a remedy for depression. It is for hypothyroidism. Fat person with full moon face. Weeping without reason. Alternate mood. Alternate excitation and increased activity, then state of fatigue. Like that. Change, heat change. 1 minute. Alternate moods are there. Dryness of skin is there. I already said face swollen, like iodine, canine hunger is there, polydipsia is there, constipation is there. That is cortisone. Another remedy is DNA, Mongolism, mental backwardness, and it is towards hyperthyroidism we are using. This Julian wrote it as dysthyroidia towards hyperthyroidism. It is a remedy for vitiligo, white spot on index finger. Vitiligo, we got many Julian remedy. ACTH is there, DNA is there, hypophysin LP is there, cobalt nitric is there, many remedies. DNA is remedy for alopecia, it's a remedy for psoriasis, etc. Any next remedy is unavailable medicines. I didn't get the medicine for everywhere, but the good material is there. Majeptil, MAJEPTIL, Majeptil. It is for hypothyroidism with obesity. Majeptil. Many other condition it is good remedy, schizophrenia, TAO, Parkinson, etc. Second remedy is Nepenthes. Nepenthes, I think sometimes available. Nepenthes. It is retardation of growth of children. We got many remedies, retardation of growth. One is beta carbuino. The other is Merck precipitate alb, Thuja, Medorinum, etc. But Nepenthes is for retardation of growth in children and patients with great fatigue, depressed, impatient, and thyroid cancer. It is a remedy for thyroid cancer. It is a remedy for endometriosis. It is a remedy for sterility. Thyroid cancer remedy and Nepenthes. Another remedy is VAB. Capital A, capital V, capital A, capital B. That is prepared from BCG, TB vaccine, BCG. It is a remedy for hypothyroidism, Julian says. It is a remedy for hypothyroidism. And hyper symptoms also are also there. Sweat, tremor, and palpitation, emaciation, you can see. Another remedy is Sarathamnus coparius. Don't tell it as Sarah Thomas. Sarathamnus coparius. SAROTHAMNUS. Sarathamnus coparius. In this drug, thyroid increases in volume, increased size of thyroid, congestion in thyroid, sweat palm, emaciation. So it is a loss of hair in tufts and explosive character. So it is used in hyperthyroidism. Another unavailable medicine, Radix angelica sinensis. That is heavy sweat, loss of weight, sometimes obesity, and tension in the thyroid, so that he cannot button the column like lactasis. Tension in the thyroid, so he cannot button it. Another remedy is onopodon acanthium, single symptom, tension in the area of thyroid. Another remedy is levofloxacin, obesity symptom like fucus, RNA, hypothalamus, lassitude, weakness, and psychomotor depressive state. Last medicine is lopophytum leandri. Lopophytum leandri. This is for hypothyroidism, simple goiter, and also for exothalamic goiter. Emaciation is there, and a brutal fatigue is there. And about the remedies, it is over. Now, just in last class, I think Dr. Chandrabanu or Dr. Ravish told something about cresol, not related to thyroid. Cresol I am using. My father cresol used it for hypertension of youngsters and Parkinson's disease. I tried it for CRF, but I didn't get any relief. Cresol, you can see detailed proving in Julian. It is for hypertension, it is for DVT, it is for Parkinson, it is for epilepsy, it is for vitiligo, it is for schizophrenia and chronic renal failure. And I think it is time to stop. I think you are not bored, and many times it is interrupted. I am very sad about it. If it will help in your future, I am very happy. So, good night. Okay. Manoj, you can take. Manoj.
Sir. Okay, sir. Thank you, sir. Thank you very
Okay.
much. I think almost 1 hour you have taken us to a world of a lot of medicines, therapeutics around 1 hour. Okay, thank you very much, sir. Thank you very much. And I think 5 to 10 minutes left actually. 10 minutes left.
Okay.
Some doctors, if anybody having some doubts, they can just, sir, if you don't mind, they can just clear their doubts. No, sir.
Okay.
Some 10 minutes we can allow. Some 10 minutes. Okay, sir.
One attendant is asking about thallium. I bit potency, he asked. I usually use thallium 30 potency, alternate day. 1 dose, alternate day. Okay.
Sir, thallium 30 hair falling in പറഞ്ഞല്ലോ sir, അതും alternate days കൊടുത്താൽ മതിയോ?
Yes, alternate days for hair falling.
Okay, thank you, sir. Sir, DNA
DNA available potency, DNA RNA extra available potency, that is all.
Sir, sulfanilamide കുറിച്ച് അധികം ഒന്നും പറഞ്ഞില്ല. Sir പറഞ്ഞത്
Sulfanilamide വളരെ only very little. Only it has got very much fatigue and lassitude, and it is indolent and always confused. And it is a thyroid remedy hypothyroid remedy according to Julian. You can see it in Julian. In Boric, I don't know it is whether it is or the DNA. I am using one time. In one case, I used it in Mongolism. I didn't get any result. Not used much DNA. Some questions are coming. Cresol for renal failure. Cresol, I have got only one potency, that is 30. I use it on alternate days, but I didn't get any result. Sometimes it is due to my prescription failure. In proving it is that. Detailed proving is that. 3 or 4 pages of material medical Julian. You have to read that.
Sir?
So
you told something about gynecal enlargement, something like that, no? What is that?
What? Please, pardon?
Gynecal enlargement or something you told, no?
Gynecal. I don't understand.
Sir, gynecoid obesity.
Yes. Gynecoid obesity. Yes. That in men. Hello. Like ammonium more obesity mainly seen in the buttock. Usually in women you can see that. In case of men, if it is coming, it is gynoid obesity. You can see in hypothalamus and you can see in ammonium more. Okay.
Thanks, sir.
So regarding Merck bin iodine, Merck protoid, some side effects you told, no, sir?
Yes, very important, and we'll get very good result in many cases. For example, in enlarged thyroid, if we are giving for right side thyroid enlargement, Merck iod flav, high potency, 10 etc., you get very fast result. In left side thyroid enlargement, you can give Merck iodide robe. Right side, there are also Silesia, Oromide also, other medicine, lycopody also.
Oh, thank you, sir. Thank you. So regarding this side effects, while studying, we used to use like bin iodine protoid. One is left, one is right.
Yes, I usually like to talk about iod flav mycide rope. That is confusing. Yes.
Okay, same thing. But we used to say.
I used to say like
priest
this.
There is a priest is
For
right.
goiter, other remedies, aconite and lycopene. You read in Clark, you can get good narration. Aconite and lycopene is an important remedy. Thyroidnum, usually when we got the correct symptom, it is high potency thyroidnum. Low potency, we are giving, just giving like that. Sometimes we get good result, sometimes not. Likewise, giving calcareous iodide 3x. If good symptoms are there, we can give high potency single dose.
Sir, carbonium sulfur, sir, sleepy എന്ന് മാത്രമേ പറഞ്ഞുള്ളൂ. വേറെ എന്തെങ്കിലും ഫീച്ചേഴ്സ് ഉണ്ടോ carbonium sulfur?
Carbonium sulfur got the power of making thyroid enlargement. One remedy for thyroid enlargement. Another remedy, it is for sleepiness. Sleepiness is important in hypo. Because in one case of year before, one paralysis case of a young boy, he lied paralysis for 4 years. After my treatment, he almost okay, and he got always sleepiness. I applied carbonium sulfur 10 and he completely okay. Now he is a potter. In hypothyroidism also, if I got no result and sleepiness is the prominent thing, I go for sleepy remedies like carbonium sulfur, opium, nex mosquita, like remedies. Okay.
Okay, sir. Okay, thank you. The other medicine we all remember, opium, nex mosquita and all.
Yes.
But we don't remember carbonium sulfur in that.
Yes.
Thank you, sir.
Detail material medica, you got everything in detail.
Yes.
Hello, Dr. Jayakumar.
Oh. ഞാൻ ക്രിസോളെ പറ്റി പറഞ്ഞത് കേട്ടോ. ക്രിസോളിനെ പറ്റി നിങ്ങൾ പറഞ്ഞപ്പോ ഞാൻ
Wonderful session. Okay.
Hello.
One more thing. So many doctors are asking about carbonium salt. And in my experience, it's a very good nervous affection.
Yes.
Actually, it is very sensitive drug. Very sensitiveness.
Yes,
but its indication is in diminished sensibility of upper and lower extremities. And along with that, the keynote symptom is it's very sensitive to noise also.
That's very few remedies got.
Yeah. Yes. Like Thyroid and carbonium sulfur is a very high-rank drug for this sensitive to noise. And another thing is sulfan. Somebody has asked about sulfanilamide,
Yes.
And it's a very good drug for this pigmentation. Actually, I told cresol for this pigmentation, but actually I don't have cresol with me. And I'm using sulfanilamide, and it's a very good.
Cresol is available,
Yeah,
easily available.
I got the information when I took the session. And after I'm ordering that also. Okay. But it's a very good remedy for the sulfanilamide. Is very good remedy for hypoglycemic shock also. And,
okay, thank you, doctor. Thank you very much.
Cresol is regularly prescribed by my father for hypertension. That is my old memory.
Hello, doctor.
Hello.
Which was the medicine you said for nasal polyp?
Low-percolate. Nasal polyp, there are so many medicine. One very important medicine is Bavulnosode, Morgan Gardner. you will get very good result. Morgan Gardner, you know, Morgan Gardner, lamina minor, calcarea fos, lupa operculata, sanguine nitricum, sang nitricum, etc. There are many. Morgan Gardner is very important.
Okay.
Keynote remedy.
Okay, sir. Thank you.
സർ ഒരു ചെറിയ ഡൗട്ട് സാർ റവോൾഫിയനെ പറ്റി പറഞ്ഞിരുന്നല്ലോ.
Yes.
അപ്പൊ അതിലിപ്പോ റവോൾഫിയ നമ്മൾ ഈ ഹൈപ്പർ ടെൻഷന് വേണ്ടി കുറെ കാലം ചില ഡോക്ടേഴ്സ് നമ്മളടക്കം കൊടുക്കാറുണ്ട്. അപ്പൊ അത് ഏതെങ്കിലും വിധത്തിൽ ഗ്രേവ്സ് ഡിസീസിനെ ബാധിക്കുമോ? ഗ്രേവ്സ് ഡിസീസ് വരാൻ സാധ്യതയുണ്ടോ?
I don't know. I am not using Ravolfia like that. Because in some people you got action, in some people not. And Ravolfia is not curing the case otherwise. Ravolfia main symptom for hypertension is the body heat feeling in the body. You can see this in paracetamol also. If heat feeling in the head, you think Asteria rubens. Congestive remedies. RNA detailed material you get in Julian. Please read Julian. Sleepiness is there. Okay.
Thank you, sir.
Dr. Srinivas?
Yes, sir.
He is asking about Ravolfia serpentina. Okay.
Srinivas is from place Srinivas?
Yeah,
Kasaragod, sir. Neeleshwar.
One Srinivas in Thrissur.
That is a very good question. In the long run, Ravolfia will create thyroid disorders, of course. And this is very vascularity creating drug, no? So after a long time usage of Ravolfia, it will go into increased vascularity, and the patient will be going to degenerative changes. Okay.
Okay, sir.
So it is better to minimize the dose or change the potency like that. Okay. Don't give so many days for this thyroid disorders, Ravolfia serpentina. Like hypertension also, it's better to, once it's controlled the condition, you just stop the medicine. Okay.
Okay, sir.
So regarding the use of Ravolfia, some observed it seems like a patient developing APD, acid peptic disease. I don't know exactly. I read somewhere else and communicated with some other doctors. They used to say don't give Ravolfia continuously for hypertension. Patient may develop APD. I don't know, sir, whether it is right or wrong.
I also don't know.
Sir, one doubt somebody asked, atopic dermatitis. What's your...
topic not related to this topic, but it is a main remedy. One nosod is there, AD. Now it is not available. Formerly it is getting from Calcutta. AD 0/1, 0/2, etc. Now it is not available. And atopic dermatitis, we have to give, in case of infant, if his cheek is very rough, I like to give anti-growth in small dose. Small, infrequent dose, anti-growth. And the remedies, natramure, sulfur, graphitis, bacillinum. Either side, you can see the same lesion, you can give bacillinum in cerebral protective. Tifilnum you can give in symmetrical case.
Okay, thank you, sir. Anti-growth 30 infrequently.
Infrequently, very in infant, very low dose, very small dose.
Okay.
And to me, I will suggest Jabarandi for atopic dermatitis. Jabarandi.
That is
because there is there is lack of secretion is there now. So to promote the secretion, you can give Jabarandi also in 3x potency or like that.
Histamine also.
Histamine also. Histamine to control the itching and all. Okay.
Yes.
Okay, thank you very much, sir.
I would like to extend our thank and gratitude to Dr. Jayakumar for this wonderful session. Thank you very much, sir. Thank you very much. And very good night to all the doctors attended this session. Even though a Sunday, a rest day, even relaxed day, but all came in time and attended the session eagerly. That is the feedback we are getting. And once more, thank you, sir, and good night to all other doctors.